Female Sexual Arousal Disorder FSAD. It is classified under female sexual dysfunction, sexual health issue. Look at this picture, shows that experiencing anxiety, depression. Look at this pathophysiology of FSAD. A detail going on. Introduction. FSAD is a condition characterized by persistent or recurrent inability to attain or maintain sufficient sexual excitement, leading to personal distress or interpersonal difficulty. FSAD can affect a woman's quality of life, self-esteem, and relationship. A definition: FSAD is classified under female sexual dysfunction and is defined as a lack of or significant reduction in sexual arousal that is not solely attributed to inadequate sexual stimulation, psychological disorders, or substance use. It can be lifelong, present from the onset of sexual activity, or acquired, developing after a period of normal function. Etymology: the term female sexual arousal disorder originates from medical and psychological classification of sexual dysfunction, with arousal deriving from the Latin arousare, meaning to excite or awake. The term gained prominence in the late 20th century as part of the DSM, a diagnostic and statistical manual or mental disorders to describe difficulties in psychological and subjective sexual response. Types: 1. Subjective FSAD. The woman does not feel sexually arousal despite physiological signs of arousal. 2. Genital FSAD. A lack of genital response such as minimal vaginal lubrication or swelling despite mental arousal. 3. Combined FSAD, a combination of both subjective and genital FSAD. 4. Situational FSAD, arousal issues occurring only in specific situations or with certain partners. Causes: 1. Physical causes, hormonal imbalances, menopause, chronic illness, example diabetes, cardiovascular diseases, medications, example antidepressants, antihypertensives, pelvic surgery, and substance abuse. 2. Psychological causes, anxiety, depression, past trauma, stress, low self-esteem, and body image issues. 3. Relational causes, marital conflicts, lack of intimacy, unresolved emotional issues with a partner. 4. Lifestyle factors, lack of exercise, smoking, alcohol use, and poor diet. Risk factors: 1. Age related to hormonal changes. 2. History of sexual abuse or trauma. 3. Chronic disease such as diabetes or multiple sclerosis. 4. Mental health conditions like anxiety and depression. 5. Side effects of medications. 6. Relationship conflicts. Complications: 1. Decreased quality of life and self-esteem. 2. Relationship dissatisfaction or breakdown. 3. Increased stress and anxiety. 4. Risk of developing other sexual dysfunctions. Pathophysiology. The pathophysiology of female sexual arousal disorder involves multiple physiological, neurological, and hormonal. Psychological factors. Here is a step by step breakdown. 1. Stimulus perception impairment. 2. Neurovascular dysfunction. 3. Hormonal dysregulation. 4. Reduced vaginal lubrication. 5. Psychological and emotional factors. Anxiety, depression, past trauma, or relationship issues can inhibit the brain's arousal response. Overactive inhibitory pathway suppresses sexual excitement. 6. Chronic conditions and medication effects. Diabetes, cardiovascular disease, and antidepressants can impair arousal by affecting blood flow and nerve signaling. 7. Persistent arousal inhibition. Over time, repeated inhibition of sexual response can lead to persistent FSAD, a cycle of frustration, avoidance, and further arousal impairment develops. Signs and symptoms: 1. Reduced vaginal lubrication during sexual activity. 2. Lack of genital swelling or sensitivity. 3. Absence of sexual thoughts or fantasies. 4. Difficulty in achieving or maintaining arousal. 5. Pain during intercourse due to dryness. 6. Distress and frustration related to sexual activity. Diagnosis: 1. Medical history and physical examinations, assessment of underlying health conditions, hormonal levels and medications. 2. Psychological evaluation, screening for anxiety, depression and trauma. 3. Sexual function questionnaire, tool like the Female Sexual Function Index FSFI to assess sexual response. 4. Hormonal testing, estrogen, testosterone and thyroid hormone levels. 5. Pelvic examination, checking for vaginal atrophy, inflammation or nerve damage. Nursing diagnosis: 1. Sexual dysfunction related to hormonal imbalance or psychological distress. 2. Ineffective coping related to emotional distress regarding sexual performance. 3. Altered body image related to dissatisfaction with sexual function. 4. Anxiety related to fear of intimacy and relationship issues. Disease management. First, medical management. 1. Hormonal therapy, estrogen therapy for post-menopausal women. 2. Use of lubricants and vaginal moisturizers. 3. Medications like sildenafil improve genital blood flow. 4. Treatment of underlying medical conditions. Nursing management. 1. Educating patient about FSAD and its causes to encourage open communication with partners. 3. Stress management techniques. 4. Counseling and support groups. 5. Encouraging a healthy lifestyle, exercise, balanced diet, smoking cessation. Treatment options: 1. Pharmacological treatment, estrogen therapy, testosterone supplements, PDE5 inhibitors. 2. Psychotherapy, cognitive behavioral therapy to address emotional and psychological barriers. 3. Sex therapy, professional guidance on improving intimacy and sexual experiences. 4. Pelvic floor therapy, strengthening pelvic muscles to enhance arousal response. 5. Lifestyle modifications, diet, exercise, stress management, and avoiding substance abuse. Psychosocial medicine. 1. Cognitive behavioral therapy, CBT, helps reframe negative sexual thoughts and reduce anxiety. 2. Mindfulness and sensate focus therapy, enhances awareness of body sensations and reduces performance pressure. 3. Couples therapy improves communication and relationship satisfaction. 4. Support groups provide emotional support from others with similar experiences. 5. Sexual education and counseling addresses misconceptions and promotes sexual health awareness. Prevention. 1. Maintaining a healthy lifestyle, regular exercise, a nutrient diet, stress management. 2. Open communication about sexual health with partners. 3. Regular medical checkups to manage chronic illness. 4. Seeking early interventions for sexual dysfunction. 5. Practicing relaxation techniques to reduce performance anxiety. In conclusion, female sexual arousal disorder is a complex condition that can have significant physical, emotional, and relationship impacts. Understanding its causes, symptoms, and treatment options is essential for effective management. A multidisciplinary approach, including medical treatment, psychotherapy, and lifestyle modifications, can significantly improve sexual health and overall well being. Thank you. Have a nice day.